In her childhood home on the Capilano Reserve, Chanel Lewis Winkles gave birth to both her sons.
Say cheese.
They were born hearing their grandmother speak Squamish Sneechem, the language of the Squamish Nation. And her next child will be too.
Right when Ollie was born, she spoke language to him. And
same with Quinn. The first few words they both heard coming into the world were in Squamish Sneechem.
She gave birth with the help of an Indigenous doula who says she helped her feel safe. Childbirth can be a vulnerable time, and for many Indigenous women, that's compounded by a hospital system that doesn't always understand their needs.
When they go into the medical system or they go into the hospitals, there's a disconnect between what they want, who they feel like they are, and who the doctor thinks they are.
Linda Jones runs the doula program for the BC Association of Aboriginal Friendship Centres. Since 2016, the number of women becoming doulas has increased sixfold. Indigenous women make up more than 1/3 of that increase. Part of that is linked to funding for Indigenous families to work with a doula.
Part of our program is to make sure that we can increase the capacity in the more rural and remote communities in British Columbia. And by doing that, more families can access care and are more open to the holistic approach to birthing rather than the medicalized.
So we've got a smokeless smudge spray.
Simone Carrier has been a trained doula for a decade.
I just fell in love with the work and just getting to watch women go through that process, watching how empowered they could feel, how strong and resilient they are in such a vulnerable state.
She is Haitian and Cree from the Red River of Manitoba and works with Indigenous clients. When it comes to her patients' well-being, she says one of her responsibilities is to offer cultural care.
If they end up getting to the hospital before I arrive, they talk about just being talked down to at times, not feeling like their care providers are really culturally informed or being safe with them. Having the doula there present, it does create another sense of like a barrier and a form of protection to allow for cultural practices to come in, whether that's through song, drums, smudging ceremonies, and just navigating it that way.
Doulas blend traditional and contemporary birthing practices. They differ from midwives, who require formal medical training. In BC, Indigenous families can apply for up to $1,200 for doula support. For this expectant mother, giving birth at home with the help of a doula means her children are literally born into the culture of their people.
It's just such an incredible experience. And yeah, I think just trusting your body, your instincts is such a big part of it too. Just knowing our ancestors have done this for years beforehand, before hospitals were a part of the picture.
Wawmeesh Hamilton, CBC News, Vancouver.